A Tale of Two Hygienists presents this week's TIPisode. Quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode.
Everyone, thank you for joining us for this special episode. I'm really excited about this one because we're going to bring you guys a new product, potentially new product. You might have seen it on the trade shows if you've gone to any conferences lately. But we're joined by Jen Rothenburg, and she's going to talk to us about this really cool product that has to do with not local anesthesia, but local anesthesia. Explain who you are and more about this product.
Andrew, thank you so much for having me today. My name is Jen Rothenburg. I'm a dental hygienist. I've been a dental hygienist for close to 30 years now. This is basically redefining your patient experience in all levels. So it's your hygiene appointment, it's your doctor's appointment, it's getting the patient in a comfortable state. So if you have a patient coming in with any sensitivity or anything like that, this device will do that for you. It's new wave technology, so subsensory pulsewave technology. It goes down 1 centimeter, and really it's neuromodulation. And Tom Viola, you could probably speak on that as well, because here we go again. So where medical, there's a disconnect with dental. This technology has been around the medical since the 1960s. They've used it for spinal injuries. So they are implanting it in the head. It's safe. It works. They know it works. So we're introducing it now to the dental. So in the oral cavity, we have thousands of nerve endings. So this will go down. It's a light little pressure that you put on, and you just rub it up and down the area. And again, it goes down into about 1 centimeter in, and it removes any discomfort. So it basically talks to your nerves. It tells your nerves and tells your brain, leave this area alone. It's all set. Like, go focus on another area. It has that cascading effect. So that's kind of all what it does.
I think a really good point for the listeners, if you wanted to, if you're not driving, pause this right now. What website could they go to see what the device looks like? Because they need to imagine in their head what this looks like as you continue to talk about it.
Yeah, so you can go to synapse.com and kind of look at this. We also had an article recently in RDH magazine this past fall, so they can also pick that up and look at that.
So we'll link to that in the show notes, so everyone, you can just go there and click the link. Because I think that, this is an audio podcast, so it's kind of hard because I know this is, you guys need to come to these shows, get hands-on experience, see it, feel it. Because it's interesting. So I'm going to try and describe it, the appearance for me, because I'm whatever. So it's a wand-looking device.
A wand-looking device, pen-shaped.
Pen-shaped. Marker-shaped?
Yeah.
A little bit thicker?
Kind of a little bit thicker than,
At the end.
2 tips. 2
tips that have kind of like rounded edges on the tip, so it doesn't. So there's not going to be anything pokey for our patients.
Not pokey. These are just like little metal steel little balls.
Yeah.
So
and it's
lightweight, very lightweight. Yes, extremely lightweight. So easy to turn on. Right in the center is your on button. You're going to turn it on. At the tip, the light will turn blue, and then you know that these tips are ready to use.
So you just touched it after you turned it on. So it's not going to shock you and do all these things. There's no danger to any of this.
No danger. It's only 10 kilohertz. So that's it.
Yeah.
But again, how many nerve endings do we have?
Right.
This also does soft tissue and hard tissue. What a game changer, right? Yeah. So our topical only does soft tissue.
Does it help with orthodontic patients?
Yes, it does. So for your orthodontic patients, you can use it prior to a bonding. You can use it prior to a debonding. You can use it throughout your treatment. There's an in-office wand. You just remove. The tips are autoclavable. So you would just pop them off and then autoclave. I know, what a game changer, right?
Okay.
So, but there's also in home use. So you can build it. So there's insurance codes that you can use. There's also, you can build this in with your treatment plan.
How long does it last when they take it home?
Yeah, so that's a great question. So the unit itself lasts 330 minutes. To do a full dentition, to kind of break it down, to do a full dentition, it takes me about 2 minutes. And that's 32 teeth that I will do. So that's, full dentition. And so, yes, with your orthodontic patients, they can bring it home. Any discomfort they have. So Joey goes off to camp in Maine, send him off with the Synapse. If he has any discomfort, he can use that. That buys you time to get them seen with their orthodontist or get them home. So orthodontic patients, yes, it's a game changer in that realm.
And also for like canker sores or...
Yes, canker sores. So all you're going to do is outline that canker sore, takes that pain right away. So say right this morning, I jabbed myself with a toothbrush. I've got this big canker sore. I'm here on this podcast. I want to be able, I could just use it. Tom, when next time you go to do lecture, you can just outline that area. You're good to go, man.
I have to outline everybody's brain with that thing from hearing me speak for 3 hours.
You're engaging. You're awesome.
Yeah, we love you, Tom. Yeah.
So it's subsensory pulse wave technology. That's the secret behind it. And why I get excited about it is it's non-pharmacologic. It's not benzocaine. It's not lidocaine. It's not topical anesthetics. It's nothing that we've ever used before in dentistry, as you pointed out, but it's been a long time coming. We should have used it because in medicine it's been used in TENS units and other devices for literally decades, and we haven't even touched the surface in dentistry. So I'm real excited about it as well. Yeah. And it's great to just leave on the tray. It doesn't go in a drawer. It doesn't go hiding somewhere. It's on the tray. It generates the patient's interest, and they want the home unit. And what the heck, they can use it at home and get just as good results. So it's a game changer.
So let's talk about like the actual procedure part of it, because I think the listeners gone to the website. They've seen it now. They've heard the description of it, but how do they actually use it?
Okay, so being a dental hygienist in my realm, so I work in a nonprofit clinic, Tri-City Health Partnership, and the patients that we see, they're usually, one, have never seen a dentist. So I don't have a dentist on hand. I have my local anesthetic license, but I don't have a dentist there. So what can I use? Topical. So this has been beyond a game changer. I have this on every single one of my tray setups. So it's right next to my handpiece, my Profi handpiece. I just put it on there. I do my oral cancer screening, and then I take this out. I rub it up as I'm educating my patients, and then I probe.
And it's up and down the root surface?
It is.
On the gingival?
Yeah, okay. Andrew, just visualize painting a fence. That's all that you're doing. And anatomy is a little different. You can go horizontal as well. You can go in circular motions, but you kind of want to go down to that apex and back as best as possible. You're just going up and down and kind of like flossing, right? You're just kind of going up and down that 3 to 5 times, and then areas that have that little bit of more recession, we know all those areas, tooth number 14, we've got those mandibular anteriors. I'm going to go on the buccal surface or the facial surface. I'm also going to go on the lingual. Then I'm going to lay it on the tooth itself. So it really gets, right? Think
Excellent.
of what does recession look like, right? We have all those, so yeah.
How long does it last when you apply it?
It lasts 24 to 48 hours.
Wow.
Nice.
So
really?
I'm doing an SRP with just this. I'm going down to an 8mm pocket using just this.
That's a game changer.
It is a game changer, Tom, 100%. My patient, at the end of the appointment, their head is exactly where they started. They're not on the other side of the room. My ergonomics is, I can be there. My patient's hands, they're not clenching. I wish I had like a GoPro on my loops so you could see the patient's reaction. And you know what? They turn. Thank you so much. Yeah. That was such a comfortable, can I reschedule with you? And I'm like, it wasn't me, it was this, but
But yeah, you're welcome for that.
Yeah.
Can we talk a little bit about the insurance coding? Do you know those codes off the top of your head? Because here's my thing. I'm coming from a production-based model. I think many listeners are production-based model. We get our income based on production. And so my concern would be we do topical and we do build it out, and that is part of what we earn. So we need something to not really affect that.
Yeah.
So how do we do that?
So you would use the codes, the desensitizing codes that you would use. So the D9110, the D9910, and the D9630. These are all on our website as well. So and the D7465, and you get reimbursed for those. So it's great. So you have a patient coming in for an emergency. Your patient, your schedule is booked. It relieves that stress within that practice.
Yeah.
First thing we're going to do is get them out of pain.
Right.
But it works.
We don't do that.
It works fast. It's 5 seconds, right?
5 seconds.
Amazing.
Yeah,
Amazing stuff.
for 24 to 48 hours. So you have a patient that calls, they're going away on a business trip or they're going away on vacation. They're in discomfort. They need to be seen now. You have, an implant. You have this, you have that. You have nowhere to get them in. You can have them come in. Your assistant puts this on, gets them out of pain, then takes an x-ray. They're able to have that one-on-one conversation, rather than, oh, you know what, we got to refer you to an endodontist. So take some Advil. Well, Tom, you can talk on that, right?
All day long.
Yeah.
And I can tell you that when I first used this myself and when I first saw it used, I was blown away and almost a little taken aback. Like, this could literally change what we do for pain modification in dentistry. I mean, honestly, it works better than some analgesics because it works faster and longer than you swallowing Advil or Tylenol, even in combination.
Right. You have to wait for those medications. This is drug-free.
And there's no side effects.
No side effects. Yeah. Nothing at all. So you can have, again, your orthodontic patient. So my son got his wire changed. He came home. He's like, I'm not going to be able to eat dinner. I can't go to baseball. I'm like, Josh, just go up and down the routes. He was able to do it. He's like, holy cow.
Yeah.
This worked.
And you do have videos on your website, correct? To show how to use it?
We do have videos, and we can do demos with the practices as well. So kind of going over, because it's not just for your hygiene department. It's not just for your doctors. It's for your whole entire practice. And this should be not in a drawer, like Tom said. This should be out and on every hygiene tray, because we want our patients to have the best experience they possibly can. So that's why we got into dentistry, right? We want to provide a service. We want to help them.
And in orthodontics, one of the most horrifying times you can have is having your bands placed. So then what do you do for the next 48 to 72 hours? You place benzocaine or topical on that over and over again, thinking that you're only relief for pain, but realizing that benzocaine applied to those surfaces for long periods causes burn, causes more inflammation and more discomfort. So why not have this available at home that you can use on the bands to relieve that pain, drug-free and no side effects?
100%. Yeah.
So, and then if the patient is taking it home, do you guys have, I know this is it's going to vary across the world or whatever, but do you have a recommendation on price point for what is this going to cost the patient?
Oh, yeah. So right here at the Chicago Midwinter, the home patient, this is going to blow your mind, right? So the home patient unit is $40.
Wow.
The in-office with 3 autoclavable tips, the in-office is $55.
Fantastic.
So, I mean, this is a game changer. This is.
And they can buy more tips if they need extra tips. Can they buy that separately?
The office? Oh, yeah, for sure.
Yeah. Okay.
Yeah. So definitely. But again, this is, you're just, it's unbelievable. So the price point is there for your patients. You have insurance codes. It's FDA approved.
Wow.
FDA, they went through all the FDA clearance, which is great. I mean, it really just, it's redefining the way that we are treating our patients. Yeah. That compassion care is coming back, and we're able to let them know. So like what Tom was saying with the orthodontic patient, there's 20 million orthodontists, right? And most people go to one orthodontist for a consultation, go to another orthodontist consultation. So now you're saying, hey, I have the Synapse that you'll take home. It'll keep Joey, out of any discomfort throughout his dental treatment. Joey brings us with every appointment. While he's waiting, he's just rubbing it up and down his gums, completely comfortable.
Yeah, it's phenomenal.
It is. And before a debond, debonding is not fun, guys.
No, it's not.
No. So that patient has that. They can, what a great experience overall.
I just wanted to say that one other thing that has come across my little plate in the world of dentistry has been that people who clench a lot.
Oh, yeah.
There's a lot of sensitization because they're constantly putting pressure on their teeth. And this is one way that I've heard people use the dental pain eraser, that they've actually been able to alleviate some of that sensitization from the clenching. And a few people have told me it actually stopped them from clenching so much.
Oh, that's nice.
Pretty I did see something that it helps with TMJ.
Yes. Yeah, you can kind of go back into that area and just kind of rub it up, and that'll definitely help. Implants are big right now. Yeah. So that's that big thing. Before, removing that healing cap, we inject. So that patient has to go back to work. It's a quick appointment. It's not that big of an appointment, but we're injecting them. They're numb. No one likes to be numb.
Exactly.
I don't like to be numb. I mean, nobody likes it. I don't even like topical. They can just rub this on, remove the healing cap, place that on. So when you're thinking of also with dentistry, the big thing is your occlusion. So after placing a crown, after doing veneers, your patient isn't numb. They're going to give you that exact occlusion bite. Yeah. It's going to be the proper bite. So they're not coming back in a week, so you have to adjust or anything like that.
And I think that's huge, too, because we see a lot, like, okay, do you want to be numb? Do you not want to be numb? Well, do I need to be numb? Like, well, some people do, some people don't. We're going to go ahead and place this crown anyways. Like, well, go ahead and numb me up, because once you take off that temp, then it's exposed to all the cold air and all that stuff. And then they come back, like you said, in a week. Yeah. And I think to Tom's point earlier about the clenching and grinding, we all know that, long-term clenching, what's going to happen? Recession. Absolutely. So then we have all the sensitivity that's going to come with the recession and things like that too. So I think this is really amazing. I'm really glad that we're able to kind of share this with the world because it's an exciting new product. If someone wanted to check out more, or if they wanted to reach out to you personally, where can they find you? Where can they find the product?
Yeah, so you can definitely go to synapse.com and go to our website and, find, we're all on there that you can click on. There's a live chat, so if there's ever a question, you can put in that information and we'll get right back to you. If your office wants to do like a little demo, we can definitely do that. I mean, we're all now virtual, so we can do just, anytime, anywhere, and make that happen to give you guys that information. So definitely reach out, definitely find out this information, and start redefining the way that we really treat our patients. It's going to be amazing. And you're going to hear more and more about this. So again, we want to link that medical and dental together, and this is the way that we're going to do it.
Absolutely. Jen, thank you so much for being on. I appreciate this.
Thank you, Andrew. Thank you, Tom.
Thanks,
Thank
Jen.
you.
Thanks, everybody.
We hope you enjoyed this week's TIPisode. Be sure to reach out to our guest experts and let them know how helpful their tips were. Follow A Tale of Two Hygienists on Facebook, Instagram, and head over to ataleoftwohygienist.com and subscribe to our newsletter. You can also email us at ataleoftwohygienist@gmail.com and keep listening for more awesome content from your unofficial dental hygiene podcast.